High blood sugar levels in diabetes damages the nerves, causing pain, tingling and numbness, known as diabetic neuropathy. In 24 diabetics suffering from neuropathy, 400 milligrams per day of CoQ10 improved nerve function and symptoms of nerve damage. CoQ10 prevented nerve pain and reduced inflammation in diabetic mice. In diabetic mice, CoQ10 prevented nerve pain due to abnormally low blood sugar. For example, diabetes can cause brain dysfunction and altered levels of neurotransmitters such as serotonin. CoQ10 reduced the oxidative stress and balanced the neurotransmitter levels in the brain of the diabetic rats. CoQ10 protects the kidneys and the heart from blood sugar levels, and it improves their function in diabetic rats and mice. Male fertility is determined by the number, the count, and the quality, which is the motility and morphology of the sperm. Sperm cells rely on CoQ10 for the energy needed to move and for its antioxidant protection. A study of 22 men found that taking 60 milligrams per day for 103 days improved in vitro fertilization rates. A 26-week study of 212 men with infertility found that 300 milligrams per day of CoQ10 improved sperm count and motility. A slight increase in testosterone was also found. Supplementing with 400 milligrams per day for 6 months improved the motility in 22 men with infertility. 200 milligrams per day for 12 weeks reduced the oxidative stress in 47 infertile men. Poor ovarian reserve is a term used to describe a reduction in the quantity and the quality of immature eggs in women of reproductive age. It can reduce the success of in vitro fertilization. CoQ10 increased the IVF rate and the number of high-quality embryos in women with this condition, as well as pregnancy and live birth rates. In aging mice, CoQ10 improves the number and the health of immature eggs. In higher doses, greater than 200 milligrams per day, CoQ10 may boost fertility and sperm quality in men. More studies need to confirm its effect on testosterone levels in men and its fertility benefits in women. CoQ10 levels are often lower in people who are experiencing migraines. In multiple studies, CoQ10 at 100 to 300 milligrams per day reduced the duration, the frequency, and the severity of migraines. In one study, 150 milligrams per day reduced the number of migraines by over 50% after 3 months of use. Fibromyalgia is characterized by altered CoQ10 distribution in the body and increased oxidative stress. CoQ10 levels may be high in the blood, but low in immune cells. Supplementation can increase the CoQ10 levels in the immune cells, which protect them and lower oxidative stress. In multiple studies, CoQ10 supplementation of 100 to 300 milligrams per day improved the symptoms of fatigue, pain, headache, and depression. Supplementation also reduced inflammation and improved mitochondrial function. You could check out my video on fibromyalgia for more information about this condition. Muscular dystrophies are a group of genetic disorders that cause muscle wasting, weakness, difficulty breathing, and poor balance. In 2 studies, 27 people with muscular dystrophy were given 100 milligrams of CoQ10 daily, and it improved their ability to walk and exercise and reduced their fatigue. In 2 12-week studies of 93 people with multiple sclerosis, 500 milligrams per day of CoQ10 improved symptoms of fatigue and depression and reduced inflammation. Check out my video on multiple sclerosis for more helpful natural treatment options. A class of chemotherapy drugs called the anthracyclines cause damage to the mitochondria of the heart. CoQ10 protects the mitochondria of the heart. A review of 6 studies found that CoQ10 protected against the damage to the heart and the liver during chemotherapy. In a 5-year study of 81 people who had melanoma surgery, those who took CoQ10 at 400 milligrams per day, in addition to the anti-cancer drug, were 13 times less likely to have the cancer spread compared to the anti-cancer drug alone. The CoQ10 group also had better mood and energy levels. In rats, CoQ10 protects the kidneys from damage due to doxorubicin without interfering with its effectiveness. Mice that were given CoQ10 lived longer after being exposed to doxorubicin. Peyronie's disease is a disease which scar tissue builds up in the penis, causing curvature, erectile dysfunction, and painful intercourse. In a clinical trial of 186 people with this disease, 300 milligrams per day of CoQ10 reduced scar tissue, the curvature, and improved erectile function. Statins block the production of CoQ10 and decrease its levels. One of the most common side effects of statins is damage to the muscles, causing weakness and pain in 10 to 15% of people. These side effects may be due to low CoQ10 levels and often cause people to quit taking statins. In a study of 50 people taking statins, 100 milligrams per day of CoQ10 reduced muscle pain and improved their ability to accomplish daily activities. In 20 athletes taking statins, 200 milligrams per day improved their muscle strength. Statins can also interfere with the ability of the heart to pump blood. CoQ10 supplementation is able to reverse this and to improve heart function in people taking statins. In rats given statins, CoQ10 protects the muscle and the liver from damage, and it improves mitochondrial health. One study in 18 people with depression found that 400 to 800 milligrams per day of CoQ10 for 4 weeks reduced the severity of the depression and improved symptoms of sadness, fatigue, and difficulty concentrating. Another 8-week study of 69 people with bipolar depression found that taking 200 milligrams per day of CoQ10 improved symptoms of the depression, including fatigue and difficulty concentrating. Studies in mice reveal that the mitochondria don't function properly in depression, and CoQ10 reduces symptoms of depression and stress hormones in rats. In Parkinson's disease, dopamine neurons get destroyed. Dopamine is important for movement, learning, and feelings of reward. CoQ10 levels are lower in the mitochondria of people with early Parkinson's disease. A trial of 80 people with early Parkinson's disease found that taking either 300, 600, or 1200 milligrams daily for 16 months slowed the decline in mental and physical function. The greatest benefit was seen in groups taking 1,200 milligrams per day. In a mouse model of Parkinson's disease, CoQ10 protected dopamine-related neurons. In rats with Parkinson's, CoQ10 in combination with creatine protected the brain and prevented the loss of dopamine that occurs with the disease. Higher doses, greater than 1,200 milligrams of CoQ10 for longer periods, may help people with Parkinson's disease. Check out my video on Parkinson's for more information about this condition. Friedreich's ataxia and familial cerebellar ataxia are hereditary diseases that result in problems with muscle coordination, movement, speech, and balance. A study of 97 people found that those with Friedreich's ataxia had 33% lower levels of CoQ10. In a 2-year study of 50 people with Friedreich's ataxia, CoQ10 was given at 600 milligrams per day and vitamin E at 2,100 international units per day, and this improved walking ability, coordination, and speech. A 4-year study of 10 people with Friedreich's ataxia found that 400 milligrams per day of CoQ10 in combination with 2,100 international units of vitamin E improved walking ability and slowed the progression of the disease in 7 people. 6 cases of people with familial cerebellar ataxia found that doses between 300 milligrams per day and 3,000 milligrams per day for 1 year improved strength and well-being and muscle coordination and reduced seizure frequency. CoQ10 reduced total cholesterol and increased HDL cholesterol in people with heart disease. According to a review of 8 studies, including over 500 people. However, it had no effect on LDL cholesterol or on triglyceride levels. CoQ10 may improve cholesterol levels in people with heart disease and triglyceride levels in people with metabolic disorders. CoQ10 reduced gum inflammation in 30 people with gum disease. When applied directly to the gums, CoQ10 improved gum health and reduced bleeding. Dry mouth is thought to be caused in part by reduced ATP saliva production. Supplementing with CoQ10 increased saliva production in a study of 66 people with dry mouth. People with chronic obstructive pulmonary disease, or COPD, have difficulty breathing and lower CoQ10 levels than healthy people. In an 8-week study, CoQ10 increased oxygen in the blood, decreased heart rate during exercise, and improved exercise performance in the 21 people with COPD. In 41 people with bronchial asthma, a combination of CoQ10, vitamin E, and vitamin C reduced the doses of the corticosteroid drugs needed. You could check out my video on asthma or my video on COPD for more natural treatment options. UV radiation from the sun causes free radical damage in the skin, leading to wrinkles. CoQ10 applied to the skin decreases free radicals and inflammation and increases antioxidant levels. It also reduces the depth of wrinkles and decreases oxidative stress and DNA damage due to UV radiation. A trial of 443 elderly people showed selenium at 200 micrograms per day and CoQ10 at 200 milligrams per day over a 4-year period improved vitality, physical performance, and quality of life. There's not enough evidence to say if CoQ10 can increase lifespan, although scientists are investigating the possibility. One study in humans found that levels in multiple organs, including the heart, liver, and kidneys, all peak before the age of 20 and then decrease with age. In a study of adults aged 18 to 82, levels were the lowest in the older adults. CoQ10 increases the lifespan of rats, bees, and worms. Mice that are deficient in CoQ10 live shorter lives. Non-alcoholic fatty liver disease is a liver disorder that involves chronic inflammation. taking 100 milligrams per day of CoQ10 decreased liver enzymes AST and GGT, which are markers of inflammation, in a 12-week study of 41 people with this disorder. In rats exposed to toxins, CoQ10 reduces liver enzymes, inflammation, and damage, and increases antioxidant levels in the liver. In rats, CoQ10 prevented damage to the gut from alcohol. Non-steroidal anti-inflammatory drugs, such as ibuprofen, can cause damage to the gut. CoQ10 reduced gut damage by increased antioxidant levels and by boosting levels of gut-protective prostaglandin E2. In a rat model of ulcerative colitis, CoQ10 improved gut health by reducing oxidative stress and inflammation. Osteoporosis is a disease in which bones become weak and brittle due to bone loss. CoQ10 reduces the breakdown of bone, and it increases new bone formation in rats with osteoporosis. In rats, CoQ10 reduced the growth of tumours in the colon and blocked the development of precancerous lesions. CoQ10 increased oxidative stress and reduced cell growth in cancer cells without affecting normal cells. CoQ10 prevented cell growth and caused programmed cell death in cervical cancer cells. Alzheimer's disease is characterized by beta-amyloid plaque and tau proteins in the brain. In mice with Alzheimer's disease, CoQ10 reduces oxidative stress, beta-amyloid plaques, and tau proteins. A study of 17 people found that those taking 300 milligrams per day of CoQ10 for 1 week were able to pedal faster during a cycling workout and felt less tired. However, 150 milligrams did not increase energy output in 6 physically active people after 4 weeks. This indicates a minimum dose of 300 milligrams may be needed for athletic benefits. Huntington's disease is a genetic disorder that causes physical and mental problems early in life. Mitochondria in the brain of people with Huntington's become damaged and don't work as well as they should. You should check out my other video on Huntington's disease for more information on natural ways to help treat this condition. A study of 347 people with Huntington's disease found that taking 600 milligrams daily for 2.5 years slightly improved mental function and ability to handle day-to-day tasks. In a large, high-quality trial of 609 patients, CoQ10, taken at 2.4 grams per day for 5 years, did not slow the functional decline in the patients with Huntington's disease.